Today, we're going to be talking about how to reduce chemo side effects. Grab your coffee, your tea, water, your snacks. Just get ready for a little bit of a lengthy video, but I assure you it will be jam-packed with information. So I really wanted to talk about this topic because chemo is terrifying for most people. And for me, it was extremely anxiety producing. And a way for me to reduce that anxiety was to research chemotherapy, research side effects, try to find people that have experienced this before and have been in the shoes that I'm going to be walking in and can tell me or give me advice on what to experience. And that is why I'm making this video. When I received my diagnosis, that was probably the worst time of my life. But when I learned that I needed chemotherapy, that really drove it home. That was a whole new level of fear. It really amped up my anxiety and my fear about the whole situation. And yes, obviously because I was pregnant, but it's freaking chemo, dude. Like, I saw my mother struggle through it. I saw what some of the side effects could be. And nobody doesn't experience anxiety when they know that they're going to not be feeling well. They don't know what to expect. It's that unknown but also you know it's going to happen, but it's unknown exactly what's going to happen. It's scary. I've seen it in the movies. I'm sure you've seen TV shows and all of that kind of depict what the cancer patient is supposed to be like and look like, and also like chemotherapy. And it could be it can be so scary because that's what your mind goes to, but that's not always the reality. You anticipate the hair loss, you anticipate not feeling good. It's a very dark time, and I want to help shed light on it so it could feel a little bit lighter for you. Just like you are doing now, I hunted the internet for answers and for stories like mine, and I wanted to know what it was going to be like. Like I said, I was doing that not only to reduce the anxiety, but also because I wanted to try to find ways to cope from people who have been there before. So my goal for this video is to obviously give you my experiences of what side effects that I went through, but also some notable ones that you could also potentially experience during yours. But most importantly, I want to talk about what we could do to reduce those side effects the best that we can in order to be able to feel like we're in control again, because cancer steals the control. And the best way to combat that, and the best way to combat anxiety, in my opinion, is to control the controllables, to control what we are able to control. We have to do what we can with what we have. If you're new here, I am Lauren Kramer. I am a breast cancer while pregnant survivor. I am a stay-at-home mom of 2. I am a nurse turned holistic nutritionist, and I share my lessons learned through cancer and survivorship, healthy living, and mindset advice. And here on this channel, I also host a podcast called After the Bell, where I interview those who have been affected by cancer to share their stories and to allow what they have been through to help others. And if you are interested in that, I would love to hear from you. I have a link in the caption where you could apply to be on the show. And this is open to anybody. This is open to cancer patients, cancer survivors, cancer thrivers. This is open to co-survivors and even people who have been affected by cancer because of somebody directly in their lives. So we want to hear about it all, because the goal of the show is to get more stories out there so people can find relatable stories and find their way out of what craziness cancer can cause. So first, let's talk about the most common side effects of chemo. I'm going to talk about chemo generally, but I'm also going to be talking about from a breast cancer perspective. I personally had ACT chemo, which is adriamycin, Cytoxan, and Taxol chemo, but also it can be called doxorubicin, Cytoxan, and paclitaxel, which is specifically the drugs that I've had for chemotherapy. I'm going to get into my experience a little bit later, but first I'm just going to rattle off some of the most common side effects that are known with chemotherapy. I'm just going to pull up my little list here. So first up, obviously fatigue, hair loss, nausea, vomiting, mouth sores, changes in appetite, constipation or diarrhea, or both, bone pain, infection, changes in the skin, cognitive cognitive changes, aka chemo brain, because it's real. Chemo brain is absolutely real. And I know that there are more side effects that people can experience, but more specific, nuanced side effects that people can experience. For instance, like you could have your nails can be affected by specific chemos, whether they can get dark or they just get brittle, or there's little nuanced things. But these are the general ideas of what you can experience during chemotherapy. I just want to reiterate, these are all potential side effects. Not everybody experiences all of them, or not everybody experiences specific ones. It's not, this is not like a one size fits all. Everyone has their own unique experience and how they deal with the side effects and also what side effects they get. Everybody experiences their own set of side effects. Even if I deal with nausea and you deal with nausea, we could experience it in very different ways. So I want to give you the tools. I want to give you things that I've learned and things that I've experienced, but just know to be gentle on yourself. It's that I think is the most important part. Additionally, if you are going through chemotherapy, it's really important to tell your healthcare provider what you were experiencing, what side effects you were experiencing, because most of the time they do have something to help you with those side effects, even if you are pregnant. So whatever you are experiencing, I urge you to tell your healthcare provider, and don't think you are going to be annoying. Who cares in the grand scheme of things? This one's going to sound a little strange to talk about how to reduce side effects, but the first one I want to talk about is hair loss. Hair loss was extremely tough for me, and I know it's extremely tough for other people. And I hear a lot of times when people are saying, I know it's kind of crazy, but I'm really worried about the hair loss. And I just want to let you know that is not crazy. This isn't just like shaving your head for the fun of it. It's not superficial. You are ill and you are losing your hair against your will, and that's not okay. And it's a lot. Some people really have an attachment with their hair to their identity, especially women. And I think that's okay to feel that way. And I think noting that is a way to cope and get through this difficult time, is allowing yourself to kind of grieve the loss of your hair. The only way you're going to move on is if you allow yourself to feel your feels and grieve. Not all chemotherapies cause hair loss, but there are definitely some that are more known for causing it. If you are not sure, or if your doctor has not mentioned hair loss at all, please ask, because our doctors are great at what they do, and there's a lot of information. We are just diagnosed. This is a whole new world of information, and the doctors do their best to try to cover all of the information and not overwhelm you at the same time. So there can be things left out. Okay, so getting to the point of how we could reduce this side effect, something that I literally had no idea of before going into my treatment, was that you can actually do something called cold capping. And the idea of cold capping, it's not a perfect science, but the idea of cold capping is you wear a cap and it is like freezing your scalp essentially in order to prevent the hair follicles from falling out. I'm going to look up the actual definition so I can explain it to you best because I didn't do this. I absolutely didn't want any additional stress. I just kind of accepted the fact that I was going to lose my hair. But cold capping is preserving hair during chemotherapy. It's a technique used to prevent hair loss, and it involves wearing a specifically designed cold cap that cools the scalp to constrict blood vessels, reduce blood flow to the hair follicles. This can protect hair from damaging effects of chemotherapy drugs. How it works? Cooling. The cold caps are worn before, during, and after chemotherapy sessions. Blood flow reduction, which is when the cold temperatures constrict blood vessels in the scalp, limiting blood flow to the hair follicles, and drug exposure. So I guess the reduced blood flow can help minimize the exposure of hair follicles to chemotherapy drugs. Right, so the effectiveness, it says variable results. While cold capping can be effective for some people, results may vary depending on factors like the type of chemotherapy, individual hair sensitivity, and proper use of the cold caps. Additional considerations is that cold capping may be uncomfortable and time-consuming, and it is important to discuss the potential benefits and risks with your healthcare provider, yada, yada. So when they, and also this doesn't say this in that little description, it's expensive. It is not covered by insurance. And it's very expensive. And I'm not saying it's not worth it if you are willing to try, but it's something absolutely people need to consider, because if we're already paying for so much with our treatment, it's just another huge expense. Another thing that I didn't do this during chemotherapy, but I wish I did before, because I think you can't do it during chemo. I'm not sure if your doctor would recommend it or not, so always ask. But microblading your eyebrows, because then when you lose your eyebrows, you have beautiful microbladed eyebrows that you don't have to do anything with. And I did this after, because my eyebrows were shot. But I definitely wish I did it earlier. I actually, when I had my microblading done, when I filled out the form to do it, I actually had to get a note from my oncologist, even after this was after chemotherapy, to clear me from doing the microblading. Always ask. Anytime you're going through chemotherapy, just go to my chart, say, yo, doc, can I get my eyebrows microbladed? Can I get a pedicure? Can I not do this anymore? Because it sucks. And in regards to the wigs, I got fitted for a wig, and it was it was like $400. I thought I was going to get it reimbursed from insurance, and I didn't, because your insurance requires specific places to get wigs. I went to the wrong place. I also got some wigs on Amazon, which I'll link below, but I wore them under hats, and honestly, like, I liked those much better than my expensive wigs. So experiment, and I highly suggest trying the inexpensive stuff first, if that is something you are into. I pre-purchased some head scarves and some caps to try on even before I lost my hair, because I kind of wanted to just see what it would feel like to have it on. The next one I want to talk about is fatigue. You will experience fatigue 100%. There's no way to get rid of it. Certain chemos, it is progressive. So what that means is each time you have chemotherapy, it hits a little harder, and it kind of adds to what you already were feeling. Ways to combat fatigue. You're going to hear a lot of similar things to combat side effects, but obviously number one is rest. And it doesn't mean just sleeping all the time, but it means taking it easy when you are doing things. You're going to start feeling better after chemo days, and you may want to do all the things, but make sure you're just taking it easy and trying to nourish your body. Balanced diets, making sure you're trying to get enough macros and micros, it means carbs, fats, proteins, as well as nutrient dense foods, is really important, because the chemotherapy is depleting your body. It's depleting your immune system. And the best thing we can do to combat that is to have a well-balanced diet and make sure we're eating enough. And I say that with another disclaimer, because it's really hard sometimes to eat during chemo. And sometimes all you can do is eat like your comfort food. And sometimes you could do is have a bowl of ice cream, because that's the only thing that could taste good, because sometimes chemotherapy can affect the way you taste things. And if that's all you can do, that's all you can do. Do not be hard on yourself. If you are able to at least try to get some meals that are balanced and do your best, it goes a long way. And the last thing in regards to fatigue is you have to manage your stress. And our bodies are going to be going through a lot of physical stress for a very long time due to the chemotherapy and all the drugs that we're taking. So if we can find ways to cope with our outside stressors or avoid our outside stressors, emotional stressors, things like that, outside of our cancer journey, we need to try our best. Nausea and vomiting is the next side effect we'll talk about. And some ways we could reduce the side effects are obviously medications, because our doctor is going to already be giving you anti-nausea meds. You're probably going to get it with your chemotherapy, meaning you get a set of fluids and pre-meds before you get chemotherapy. And some of that involves anti-nausea medication. And then you also get medication to take home typically to help prevent nausea. And I want to give you a word of advice. Nausea medication usually is better to take before you experience the nausea. Like, you want to get ahead of it versus waiting till you get nauseous and then taking it. This one's a little tough, because nausea medication can also make you extremely constipated, and so can chemo. And I will tell you that one of the worst side effects with my first round of chemo, or first 2 rounds of chemo, on adriamycin Cytoxan, the red devil, constipation was my worst. I've never experienced it like that before. We'll talk about that when we talk about constipation, but that is the negative side of anti-nausea medication, is you can get extremely constipated. So with that, you want to stay hydrated. So if you're taking anti-nausea medication, stay as hydrated as possible. And generally around your chemotherapy days, stay hydrated. You want to try it. Sometimes it's going to be hard to drink. Like I said, it's going to be hard to eat, but drinking water is extremely important, not only for your general health, but also to help that chemotherapy efficiently move through your system and get out of your system. So if you are dehydrated, you can just imagine your body holding on to that drug a little bit longer and having longer side effects. So hydration is extremely important, and you're going to hear me say that over and over again, but do your best to stay hydrated, whether you're doing little sips throughout the day, or if you're able to drink enough, drink. And also, when you're first learning about your chemo side effects, meaning when you just start chemotherapy, start off with small meals. You don't want to overwhelm your body. So start off with small meals, see how your body's tolerating chemo for the first couple days, and take it from there. You're going to learn a lot each time you have chemo. So you're just going to only get smarter and more efficient as you go through this process. All right, the next one up is mouth sores. I did experience this as well. I will say this is different. What I experienced was different from, I guess, like a regular like little mouth sore. It felt like my tongue was extremely tender on the sides where I couldn't even like speak. This happened with like one round of chemo that was extremely bad. It took a little bit to heal because, again, like our immune systems are shot. It's going to be harder to heal while you're going through chemotherapy. So word of advice is to be extra careful. Try not to bite your tongue. Try not to bite your cheek when you're chewing food, cuts, scrapes, all those things. We want to avoid that. We want obviously softer foods, like non-irritating foods to the mouth, if at all possible. So things like, some things I'm just thinking off right at the top of my head, like pineapple can be irritating, salt and vinegar chips, things that kind of like can scratch your mouth, you want to avoid. And another thing, you want to be careful with mouthwash and toothpaste because some of that can be very strong and irritating, especially mouthwash. So if you use any mouthwash at all, I would suggest using a hydrating mouthwash. I forget the name of the one I used, but I will link it below. It helps with also dry mouth too, which is another side effect that you can get from chemotherapy. The next one is, I should have mentioned with nausea and vomiting. I feel like it goes together, but appetite changes. I've mentioned this a little bit before, but your taste can change. If you've ever been pregnant, you know that sometimes like you have food aversions or you want specific foods desperately, like ice cream, which is when I did both of my pregnancies, but mint chocolate chip specifically. And chocolate mousse cake. So good. Side note, I used to go to Costco and buy their like rectangle chocolate mousse cakes for myself. And I would like leave it in the fridge and just casually like eat it throughout the week because that warmed my soul. And this goes back to just do what makes you feel good, man. Like you have to. And that made me feel really good. So maybe not the best for me, but also, it made me happy for a split second while I emotionally ate my chocolate mousse cake. So again, with the appetite changes, small, frequent meals, if you need to, not necessary, but sometimes that's a way to combat like you are experiencing food. Nutrient dense foods really help with that. When you have the nutrients you need, your body feels that. It feels that it has what it needs. Okay. Finally, getting to constipation and diarrhea, because both of those things can absolutely happen together, apart, throughout your experience. Like I said, constipation was definitely a hurdle I had to get over initially, but I learned to deal with it. And how I did that was I prepared before chemotherapy by taking stool softeners. Definitely help, but with stool softeners, you have to stay hydrated. For me, I took Colace a couple days. I think it was like 2 days prior. I started taking the recommended dose, and I think I did that through the first day or two of chemo. I stayed extremely hydrated. I also had some chewable laxatives on board just in case. I think I used them once or twice. But this is also something that you can talk to your doctor about. They can definitely talk to you about some options to help with constipation and or diarrhea. And on the flip of that, staying hydrated when you do have diarrhea, it is extremely important to stay even more hydrated, which I know is difficult, but you have to try your best to stay hydrated. Fiber-rich foods is very important, but I do also want to note, don't overwhelm yourself with fiber if that is not your norm. If you are not somebody who really pays attention to fiber and eats fiber, and then you really want to start tightening things up and adding fiber to your diet, and you start to like overwhelm your body is not going to like that. Fiber is wonderful for you if you slowly ease yourself into it. Something that I forgot to mention for most of these things we just talked about is exercise. And it's funny that I forgot because that's probably the most important one next to hydration. So exercise, movement is extremely important to reduce all side effects. Extremely important for your health generally. And it is hard during chemo. I know for me, once I hit a certain point in pregnancy, I wasn't doing much, even walking. I had struggles walking. I had a lot of like pelvic pain and things like that. So walking was hard, but do what you can with what you have. Just because you might not be able to do exactly what you want doesn't mean you might not be able to do another thing. Movement is important. I don't even want to say exercise because that can sound really overwhelming, but if you can find a way to move while you're going through chemotherapy, it is going to be extremely beneficial to you. And then once you are done with chemotherapy and start your healing journey, you will continue that and even build upon that. And it's going to help speed up your healing process. The next side effect we're going to go over is bone pain. That is something that you can experience from chemotherapy or the drugs you take to deal with chemotherapy. Because I know Taxol is one. And then another drug that you take while you're doing chemotherapy to make sure your body can handle dose-dense chemotherapy, which means chemotherapy that's closer together, the drug that builds your white blood cell count in order to be able to do chemotherapy faster, essentially. But that can cause bone pain. A good way to combat that is make sure you're moving and exercising, hot, cold therapy, whatever you feel your body tolerates better. You could ask your doctor about Claritin and or pain medications. The next side effect is infection. And this goes back to kind of what I was talking about with the mouth sores. We are more susceptible to infection while we are going through chemotherapy. So we definitely want to make sure we are not going around lots of people. We want to avoid people who are sick, make sure we have good hygiene, make sure we're not getting any cuts, any nicks. We want to really take care of our bodies because it's going to be harder to heal. The last thing we're going to talk about in terms of side effects is cognitive changes, aka chemo brain. I feel like I still have chemo brain, combined with mom brain. And when I was pregnant, I had all three. So there was a lot not happening up there. I'm going to read a definition for chemo brain for you. So chemo brain, also known as chemotherapy-induced cognitive impairment, is a term used to describe the difficulties some people experience with thinking, memory, concentration after chemotherapy treatment. It can affect a person's ability to think clearly, remember things, process information, and multitask. I remember getting very overwhelmed by like a lot going on. It's almost like, I get overstimulated very quickly generally. But when I was going through treatment, it could also be like the mental factor, like just the stress of everything. And you can only handle so much. And I remember when I was around like a group of people and there was multiple conversations, my son was in the background being loud, like I could not focus. Like I had to leave the room. I would get very overwhelmed. Like my brain just couldn't handle it all. And I think that is so valid because you're just going through a lot. And this is where, again, you need to advocate for yourself, understand that what you're experiencing is temporary. So things are going to change once you stop treatment and try to heal. So after going through all of those things, I really want you to take away a couple of things. Be easy on yourself. That is the first thing because you're going through a lot. You're going to experience a lot of new things. The way you feel, you're not going to feel good. You're not going to feel good. It doesn't mean you can't live your life. You're going to learn what days during your chemotherapy treatment that you'll feel your best. So when you get your first chemotherapy, my advice to you is to start taking notes. Day 1, this is how I feel. Day 2, this is how I feel. Day 3, this is how I feel. And until you feel better, until you feel like you could start kind of like living a life again. I remember my first chemotherapy, I didn't feel as ill as I thought I would, but I definitely had some severe side effects like the constipation, etc. But it's different every time. Honestly, you experiencing something different every time, but you learn how to cope with the side effects you've already experienced. So it's just continuous learning about what's happening to your body. And having a journal, having a chemo journal is, I think, vital. And I used to just keep a note on my phone, and I would literally add everything I've experienced in there, so I could always kind of go back to it if I needed to. Stay hydrated. The best you can, stay hydrated all of the time, but most importantly, a couple days prior to chemo, the day during chemo, and the days following chemo. Hydration is so important. And if you're taking the chemotherapy, the red devil, you're going to urinate red. The chemotherapy is red, and when the first day or two, you're going to urinate red. And the more you drink, the more you're going to flush that out, and you'll see it get less and less red. And that's kind of a good indicator to know that you're staying well hydrated. I apologize for this being a long video. So if you have any specific questions, please comment. I will absolutely answer them, or you could reach out to me. My information's in the caption. I hope you the best during your experience with chemotherapy. You could absolutely do this. You'll have a learning curve. It will be difficult, but you can do it, and you're going to get through it. So just always say that to yourself. This is temporary. Look to the future. Always celebrate your wins. Just hang in there, do your best, and I will see you guys in the next one.